recording this. At the end, I usually do stop the recording, and that's just, for the dialogue. We do have a QA moment where individuals can ask the question, and we kind of have a panel of experts in the field. We do have individuals like myself that work in the field, have worked in the field with residential, and currently still work in the field with outpatient clients. So, the shocking truth about fentanyl for those that just joined. So let's start a little bit on origins. Where does fentanyl come from? It didn't just show up in the street. It started in the late 1950s, specifically 1959. It was synthesized by Paul Jensen. So, before that, it had been in research, of course, trials and how that system works. But its first general use that was was for anesthesia in operations. It was found that it was an effective chemical, and the potency it carried. It was able to put people in a state where they wouldn't feel the pain, in an operation. After in the 60s, and the patent expired, comes the 90s, where it was made into different medicinal purposes, with the intention of being medicinal, of course, with patches, specifically in 1990, when it was first introduced into clinical trials for a patch. And it was made into a patch because in palliative care, there are some individuals that when their pain management is being taken care of, they lose the part of being able to swallow a pill. A patch with the proper amount of opiate was made available for that reason, the palliative care. The lollipop, in essence, in 1988 comes with the introduction of a brand under a branding of Actic. And it has a very interesting medicinal purpose where the U.S. Air Force in Afghanistan during the wars of 2000s, it was used as a candy, fentanyl lozenges in the form of lollipops. And it was a design for common situations where individuals that were injured in blast or other trauma were given this candy for pain medication, of course. And when enough fentanyl had been absorbed in the individual, had been sedated, the lollipop will fall out of their mouth, indicating that sufficient analgesia, the candy, had been somewhat absorbed into the body, reducing the overdose effects. So that's one real world scenario where the lollipop has been introduced also.
Yeah. Also in so fentanyl. Hey, this is Julian, everyone. So in 1959, fentanyl was first synthesized. In 1961, fentanyl was patented. Patents last about 20 years. So in 1981, the patent ran out. That's why after 1981, you see now there's a patch, now there's a lollipop, now there's new doses. And it's because once the patent ran out, it's available to anyone. So anyone can now market it, distribute it, change the formula, make it transdermal, make it available in whatever form, just because the patent isn't available to the Janssen company anymore, or it wasn't renewed by the Janssen company.
Correct. And then after that it's kind of the proliferation of different patches, lollipops, and now the new dosages that have been designed to provide the opiate into administering the opiate is stronger now, the medicinal side of it. With it, of course, comes the illicit side. Go ahead. Were you gonna say something, Jim?
No, I think we're good.
Okay, perfect. Okay, so with this quick timeline, we've given you a brief description of how fentanyl had first started as a pharmaceutical, anesthesia, patch, lollipop, and the new dosages. We're going to go into medicinal purposes a little bit more and introduce you my colleague, Claudia. Go ahead, Claudia. Oh, actually, we're going to watch a video introduction origin. Sorry. My apologies.
We spent the last year at Vice News making a podcast called Painkiller. It's about fentanyl.
It made it easy to create a opioid that was powerful and could open up new markets for them, and it's synthetic. It's cheap. it's easy to be made. You're talking about millions and millions of dollars just out of 1 kilo of fentanyl.
Fentanyl is the drug causing overdose deaths to skyrocket in the United States. We brought a camera along to take you behind the scenes of our podcast as we investigate how illicit fentanyl gets into the U.S.
Está matando muchísima gente en Estados Unidos. Se adiciona, se sobrepasa de las 3 letras, como le dicen. La DEA se deja venir para acá porque es mucha la demanda que hay para allá, la verdad.
Fentanyl is a synthetic opioid. It's entirely man-made. Many of the chemicals used to make it are smuggled from China to Mexico by boat. And that's how we ended up here.
All right, so this gives a quick introduction on how, the drugs are being manufactured in Mexico with components coming mainly from China and being cooked in Mexico and, mixed up with who knows what type of chemicals, because everything changes, right, on a daily basis, whatever they have available, and making it to our streets. And with that, we're going to continue introducing the medicinal purposes with Claudia. Go ahead, Claudia.
Thank you. Hello, everyone. So moving on to medicinal purposes. So fentanyl is a synthetic opioid pain reliever. It is approved for treating severe pain, typically advanced cancer pain. Fentanyl is prescribed in the form of transdermal patches, lozenges, and pills. So if you look at the image on the top right corner, you'll see that that's how fentanyl looks when it is prescribed as a pill. The middle image represents a fentanyl patch, and that shows how it looks once it's on your body as a patch. The bottom image represents a 400 microgram fentanyl lozenge. And if you pay close attention, these doses vary, and it's important to note that just because fentanyl, when being prescribed, will vary on the dosage and the client in regards to the patient.
Mm-hmm.
Next slide.
So this slide covers a little bit more about the illicit use, specifically the overdose deaths. This is typically when we talk about the opioid epidemic. The opioid epidemic seems to have happened in 3 waves. So the first wave is represented in that blue line. It's just a rise in prescription opioid overdose deaths, meaning that in about 1999, there was a lot of lobbying going on from the pharmaceutical companies for doctors to actually prescribe their specific opioid medication. Once that happened and doctors were encouraged to do that, there were more prescriptions being filled out than were actually necessary. So there was a dramatic increase from about 1999 all the way to about 2010. From 2010, doctors were then discouraged to prescribe prescription opioids. So what ended up happening with a lot of people who were using prescription opioids from 1999 to 2010 is that they moved on to heroin because their prescription ran out. They almost had no other choice. Withdrawal is an incredibly painful process. It feels like your muscles are all cramping, your bones are being crushed, and it's one of the worst feeling withdrawals from substances. So most people didn't want to go through that process and instead chose to go to heroin, which is an illegal drug. So from 2010 to about 2013, you see a dramatic increase in heroin overdose deaths, and that's just because of the popularity of heroin. After that, you'll see wave number 3, which is the synthetic opioid overdose deaths. So synthetic opioid overdose deaths refers to tramadol, mostly fentanyl. As you saw earlier in the slides, most fentanyl is coming out of China. However, there are laws in China that say it's illegal to make fentanyl in this country unless you have XYZ documents. But there are so many factories that are making these illicit substances that there's not enough agents to enforce those laws. And so that's what's going on now. So from 2013 all the way until now, there's a dramatic increase in opioid deaths related to fentanyl, just because fentanyl is so much more powerful than morphine or heroin. Um, what the graph doesn't show is that at around the end of 2018, there's a slight drop off. However, that drop off could be attributed to um, naloxone, but we like to imagine that it's attributed to education and people knowing about the substance and all that. So it's a combination of factors. However, the drop off it's very slight. We could move on to the next slide if you want, Juan. Thanks. This chart over here shows the potency. So fentanyl is an incredibly powerful synthetic opioid that is similar to morphine, but can be anywhere from 50 to 100 times more potent. It's a Schedule II prescription drug, which means that it is legal, and it's typically used to treat patients with severe pain, or how Claudia was saying earlier, to treat for palliative care, for end-of-life care. It has sometimes been known to treat chronic pain for people who are already physically tolerant to opioids. However, let's say there was a patient using morphine and they developed a tolerance for that morphine. So then their doctor prescribed them fentanyl. Ideally, what their doctor could have done is look for other routes to deal with that pain rather than just prescribing them fentanyl, because that tends to compound the problem. Really quick, if you guys want to read Schedule 2 on your own, it's just a definition of what Schedule 2 means. It just says um, Schedule 2 drugs are legal, however, they're only legal with a prescription. So on this chart on the right, it compares the potency of all of these drugs. In the middle, it's just whether or not the product was FDA approved. So the only two products here that are not FDA approved for human consumption are heroin and carfentanil. Heroin is an illegal product, and carfentanil is actually used for large animals like rhinos and elephants and animals like that. So morphine, you can imagine that morphine is our baseline of just one. Morphine is as powerful as one, right? And it takes about a pea-sized dose to be lethal. Heroin is 2 times as strong as morphine, and it takes about a sunflower seed for that to be a lethal dose. Fentanyl is actually 100 times stronger than morphine, meaning that it could take a sesame seed of pure fentanyl to overdose a human. Sufentanil can be anywhere up to 500 times stronger, and all you need to overdose on that is a grain of sand of that substance. And carfentanil, all you need is half a grain of salt. It's 10,000 times more potent than morphine, and overdoses are very likely with carfentanil. Um, Luckily for us, we don't have to deal with sufentanil and carfentanil yet. However, those are substances that exist, and so we should be aware of them in case they ever do get into the local like illicit supply of drugs. You can go on to the next slide if you want, Juan.
So now that we've covered fentanyl's illicit use and potency, it's important to also cover the overdose risk. So most recent cases of fentanyl-related harm, overdose, and death in the United States are linked to illegally made fentanyl. And in 2018, more than 31,000 deaths involving synthetic opioids occurred in the United States, which is more deaths than from any other type of opioid. If you take a moment to look at the image to your right, you will see a penny, and next to it, you'll see what is considered a fatal dose of fentanyl. To be exact, it's 2 milligrams or 2,000 micrograms of fentanyl. When comparing it to a penny, it looks like just a little pinch of fentanyl can be very deadly to any human being and can cause an overdose. Next slide, please. moving along, I do want to emphasize and to continue to emphasize the overdose risk, because if you look at the image on the right, you'll see this map of the United States, and this map really emphasizes the drug overdose death rates involving synthetic opioids from 2017 to 2018. So if you look at California, you see that the color is pink, which depicts that there has been an increase in drug overdose death rates from synthetic opioids. So if you look at the measurements, in 2017, there was a total of 536 deaths. In 2018, there was a total of 865 deaths. The percentage change from 2017 to 2018 was 69.2%, making it a statistically significant change. So it is important to note that although this map with data has been reported from the CDC, there are a lot of data that hasn't fully been confirmed and hasn't been added to this chart. Next slide, please.
And that could be because there's underreporting or because there's issues with reporting. It could be also that not everyone who is found deceased is tested for substances. It could, there's a lot of different factors that could lead to underreporting.
Yes, you're right. Thanks for sharing that. So moving along, we have an overdose clip, and where we really want to highlight that overdose from fentanyl is occurring in our community. We're not just highlighting it today, it's something that's recurring within our community, and it's a real issue.
All right, we're gonna play the video.
Rich Strickling lost his 22-year-old son Alex earlier this year to an opioid overdose.
He was full of joy. He didn't have a mean bone in his body.
Alex's death was ruled accidental. The cause, the powerful synthetic opioid fentanyl.
Nowadays, when kids start experimenting the way that all kids do, the consequences of that experimentation are deadly.
New CDC research shows fentanyl is now the most common drug involved in drug overdose deaths in the United States. Dr. Courtney McKnight with NYU College of Global Health says fentanyl is 50 to 100 times more potent than morphine.
People don't know it's being cut into the drugs, and so they're using maybe the same amount of heroin that they're used to using, but it contains a more potent opioid, and that's in many cases leading to overdose deaths.
The study looked at death certificates of people who overdosed from 2011 to 2016 and found a 54% increase in drug overdose deaths.
Overall, more than 63,000 people died of drug overdose in 2016. Many of those overdoses often involve more than one drug.
We need to know that overdose deaths include drugs other than opioids, right? So we need to be thinking more broadly about this as a drug overdose crisis as opposed to just an opioid crisis.
After fentanyl, heroin, cocaine, and methamphetamine accounted for the highest numbers of overdose deaths by the end of the study. Ileana Diaz, CBS News, Los Angeles.
All right, and one of the things that the news clip doesn't mention is, fentanyl, aside from its availability, when we've asked clients, hey, what made you, use these type of drugs, they also mention the price. The street price are so low that it makes it a viable drug to consume just because of its cost factors. So next, we're moving on to naloxone. And we're going to give a brief explanation of what naloxone is in parts where it's a nasal injection. The first version that naloxone was distributed with was a needle type. So sometimes when you type in naloxone, sold under the most common brand is Narcan, by the way. So Narcan being the brand, naloxone being the chemical. The most common medicine form now is the nasal spray, and it's more commonly found. The needle one is still sometimes used in more of hospital settings where the individual has an IV and the medicine is inputted through there, more direct. So very little training required for the Narcan dispensed into the individual's nostrils when they've been under respiratory depression, meaning they're not breathing anymore. The medicine usually takes between 1 or 2 minutes on a first dose. So for the most part, it's a very quick acting drug, and it's designed specifically for opiates to cancel its effect. So when individual overdoses on opiates, it's usually respiratory depression.
Yeah.
And go ahead, Julie.
Yeah, the reason for that is because opioids, imagine that your brain is made up of several compartments, right? So next to the area where your brain sends the signal to your lungs to breathe, there's also the area where you feel good. Opioids cover that area like endorphins do. However, they're not the exact same shape. So they also cover the area that sends a signal for your lungs to breathe. So when naloxone when you're overdosing on opioids, that area is covered so much that the little tails of the opioid are also covering the signal for you to breathe, right? So the signal to breathe can't get through that and it can't get to your lungs. What's amazing about naloxone is that it actually has a higher affinity to the opioid receptor than opioids actually do themselves. Meaning that if you're overdosing on opioids and naloxone is administered, naloxone will immediately go to the opioid receptor site and it will actually knock the opioids off of the receptor site. It'll knock them off for, I think, about anywhere from 40 minutes to about an hour. Um, and what that means is that now the paramedics or whoever found you or whoever administered naloxone has 40 minutes to an hour to get you to a hospital, because if the dose that you took to overdose on would be in your system longer than 40 minutes to an hour, then you might overdose again. Or if the initial shot didn't work and for whatever reason, then you might go into another overdose, even though you were administered naloxone. So that's just briefly, just incredibly briefly, how naloxone works. And also naloxone, as Juan was saying, actually has no ill effects. There are no side effects for taking the medication. So if you find someone that is passed out and you suspect that they took opioids and you administer naloxone and they wake up and they were just napping or something, they'll actually be completely fine. There won't be any issues with them. There are some counter agents to other substances that when given to the person, they'll cause terrible side effects like horrible flu-like symptoms, muscle aches, cramping, headaches, and all those kinds of things. However, naloxone doesn't cause anything like that, which is why it's literally a miracle cure, you know. The thing it's why sorry, it's why it was able to curb opioid deaths starting from about 2018 forward. Sorry,
Yeah,
go
it has
ahead.
made a big difference impact. And we're gonna touch base a little bit right now next on the distribution and how, the prescription side, because even though, like Julian was talking about, um you if you give naloxone to someone that's not going through an overdose, nothing happens and there's no side effects. It's
Mhm.
still a controlled substance, and we're going to give explanation a little bit of that, of that information later on right now in a moment.
Yeah.
Anything else, Julie?
No, I think we're good. Claudia, were you gonna say something? I see that
Yeah,
your mic is open. Yeah, go
thank
ahead.
I did want to add that if you know anybody who is using naloxone or Narcan, after administering, it's very important to stay with the person, just because it will make their body feel as if there are no drugs in their system, which a lot of the times results in the person going to get more drugs because they need that high again, and that can be very fatal to them because now you have a
Double.
potential
Yeah.
double amount of drugs in your system.
Yeah, that's it. Thank you, Claudia. That is actually something that I forgot to mention. Once naloxone is in your system, now all of your opioid receptor sites are blocked, and there aren't any, even though there are opioids in your system, all the opioid sites where those opioids could land are actually blocked. So the person can feel like they're going into immediate withdrawals after naloxone has been applied to them. If you guys have a question or anything, you could type it into the chat.
And we're also going to have like a quick Q&A afterwards. So yeah, those would be the two methods. We'll
Yeah.
definitely answer those questions.
But yeah, thank you, Claudia.
All right, so we're going to continue on with my colleague, Mr. Stephen. He's going to give a quick explanation on the pharmaceutical side of it. Go ahead, Steve.
Good afternoon, everyone. So anyone can purchase naloxone nasal spray directly from a pharmacist without a doctor's prescription. All major pharmacy chains such as your CVS, Walgreens, and Rite Aids carry or have naloxone nasal spray in stock, so it's convenient for you to obtain. Most of the time, naloxone is covered through Medicaid at no cost to patients, but if a patient for some reason must pay a balance on the medication, there are several programs or coupons they can apply to obtain their life-saving medication. Although naloxone is only prescribed on a case-by-case basis, it is encouraged to have you request your doctor fill a prescription for you. Most of the time, you're not going to see the Narcan prescribed to you if you're having some sort of not a permanent opioid prescription. Naloxone nasal spray is more commonly seen prescribed to individuals who have more of a consistent opioid prescription, and I'll dive into that on the next slide. Juan, if we can move on, please. So this was some research I did, my personal experience with calling different pharmacies. I have a few named on here, but for the most part, it was the pharmacies in our local communities. So the CVS's, the Walgreens, the Rite Aids, the Walmarts, Costco, Kaiser, with Kaiser being probably the hardest to get a hold of, because I had to jump through the loop with a lot of different ones. But it was interesting to find out that Costco and Kaiser Permanente pharmacies, they make it a requirement to not only dispense one, but two Narcan or naloxone sprays. The reasoning they advised was if the first naloxone or Narcan spray does not take effect, as Julian talked about earlier, then the second spray is provided in order to administer the second dose. Some pharmacies had conflicting information when it came to prescriptions. I was advised by some that when they see a prescription for an opioid, they also see one for naloxone or Narcan. Other pharmacies advised it was a case-by-case basis, meaning prescription was for a constant opioid, mainly someone with a terminal disease, so someone with like a stage 4 cancer or someone in hospice. If they were receiving pain management medication just to make them feel comfortable, then they would also see the prescription for naloxone or Narcan. But for someone who received a prescription for a temporary opioid, examples like Tylenol with codeine, if you received the root canal procedure and your dentist prescribed you this pain management medication, then most likely they would not prescribe a naloxone or Narcan, as the Tylenol with codeine would probably be prescribed for anywhere from 7 to 10 days. But Kaiser Permanente's pharmacy was the only pharmacy that advised they are required to provide naloxone or Narcan with every opioid prescription. However, it is up to the patient if they wish to fill that prescription. That could go, there's many barriers with that, as it could be depending on the person's co-payment, whether they have to pay out of pocket or not, what their insurance would cover at that point. That determines whether or not the patient wants to fill the prescription for Narcan. But it was interesting to find out as well as the cost for naloxone. So if you purchase it out of pocket, after calling several pharmacies, I found that it could cost anywhere from $60 to $150 per device. But There are several programs, especially in LA County, that provide coupons, discounts, and cover the cost of the prescription. That way, the medication is available to any individual, as it is life-saving. As Julian talked about earlier, the decline we saw with the deaths, it's all due to the naloxone or Narcan.
Mhm.
Okay, Juan, go ahead.
All right, so now we're gonna shift gears and go a different way. We're gonna do frequently asked questions about fentanyl. Go ahead, Julian.
Yeah, so now that we scared everyone about fentanyl, here are just some things that we always get asked. Um, so can you overdose from touching the fentanyl powder? The answer to that is actually no. You can't overdose from touching just the powder. Let's say that there was like some fentanyl on my desk or something, and I touched it. It's not, my skin isn't actually porous enough for the fentanyl to get into my bloodstream and up to my brain, up to my opioid receptors. If there was fentanyl on my desk, I could just wipe it off and then wash my hands. However, if there was opioid on my desk and there was fentanyl on my desk and I didn't know, and it got into maybe one of my mucous membranes, maybe like my nose or my mouth, or maybe even in my eye, then it would be possible for me to overdose from just touching the powder, from just the powder being there and me accidentally introducing it to my face. Um, so the next question that we always get asked is, can you overdose from inhaling particles that are suspended in the air? So again, let's say there's fentanyl on my desk and I blow it all into the air and now it's in the air. So unless, again, I receive a massive dose of that, in my mouth, in my nose, in my eyes, or something like that, I won't overdose. Like if I pushed it into the air and then walked out of the room or something, I would be fine. There was a study conducted where fentanyl was being created in the laboratory. All the workers had on their personal protective equipment, and the person who was the subject of the study did not. It took somewhere around 200 minutes for that person to actually receive an effective dose of fentanyl. So that means that that person was walking around for about 3 hours in that laboratory and was completely fine until he felt the effects. So you can't overdose from inhaling the particles that are just in the air. Another question that also we get asked a lot is, are drugs being purposely laced with fentanyl? Meaning that if I am a drug dealer or something, am I putting fentanyl in whatever XYZ concoction I'm selling? The answer to that is a little bit hazy. However, it's probably not. So meaning that if I sell heroin and I'm cutting it with fentanyl, and I probably sell a lot of other drugs, right? I probably sell maybe cocaine or meth or other drugs like that. So let's say I use the same bowl to mix my heroin that I use to mix my cocaine, which doesn't seem too illogical, right? It wouldn't make sense that someone who is interested in selling drugs is very interested about cleanliness. Um, so that person probably has one container to mix all those things in. And if there is fentanyl in someone's cocaine, yes, that's very dangerous. It's very likely that they may overdose depending on how much is actually in there. However, is their drug dealer intentionally trying to kill them? The answer is no. There have been a few cases, I think in North Carolina and West Virginia, where there are like small towns that are being hit hard by the opioid crisis, where up to 26 people at a time have overdosed at around the same time. And that happens because they all purchase from one or two dealers, and then those dealers purchase from one or two suppliers. So what happens in those cases is that one or two dealers got their supply and it was a lot stronger than they thought it would be. Once they sold it to however many people they sold it to, all of those people overdose at the same time. So that's what's happening a lot. It's not that someone who is a regular cocaine user is overdosing on fentanyl because their drug dealer is purposely cutting it with that. It's that the drug fentanyl itself is so strong that only a few grains of what looks like sand is what you need to overdose on. If you look at this picture on the right, that's actually the comparison graph that I was using. So that's about 2-inch vials. So on the right, it looks like quite a large amount, right? It would probably be pretty hard for you to accidentally ingest that. It would probably be actually a lot easier for you to accidentally ingest the fentanyl. Even if you don't overdose, you may still receive an effective dose, which means that you'll still feel the effects. And carfentanil, there's almost nothing in that vial. It's just powder residue at the very bottom of the vial. So carfentanil, again, is very worrisome. However, right now we're mostly concerned about fentanyl. I think carfentanil has been found in some places, and it's been given like scary names like Gray Death and things like that. However, it's not a widespread issue just yet, but it is something that we should all still be knowledgeable about.
And just a quick side note, carfentanil is used for animal sedation, correct, Julian, for large animals?
Yeah, it's used mostly for like rhinos and elephants and just giant animals like that.
Yeah, whenever you see like bobcats being just sedated on the news, or bears because they're in La Cañada or in Lakeview Terrace, that's what they usually use, right? Carfentanil. All right, so our next slide, we're going to show a quick video on an overdose, just a disclaimer. It's some graphic images, and I don't mean by blood all over the place, but it's a real life scenario where an individual is reported to be on overdose, and how the fire department.
And
go ahead, Julian.
Also, if you have your headphones up all the way, you might want to turn it down a little bit. I think it starts with sirens. So there are going to be loud noises and slightly frightening images.
All
right. Okay, we got a report from a citizen that he saw a white male in a black vehicle slumped over like he was OD'd or something. We're going to go and investigate. That's what we're doing. Okay, right there. Yep. Door's locked. Door's locked. I thought you were going to get to be big easy. He is breathing. Let's get him out. Wait, hold on. Okay. You got him? Yep.
Does anyone know him?
No, I was at the light and I just seen the vehicle parked.
It's on. Positive. It's on.
I need a fire alarm.
Hey.
We need a medic unit to Grand and Cross Street at the intersection. We're working on an.
Hey, bud. Hey.
They got medic 911.
Hey, what's going on, man? Take a breath. Take a big breath. I'll be right back. I'm gonna get some clothes. There you go.
Gotcha.
Bud. Hey, take a breath. Big breath. You all right, man? What's your name? What's your name? What's your name? Hey, hold it, stay right here. Just relax here, okay? We're helping you out, okay? We're at the fire department, okay? We just gave you some medicine. You're overdosed, okay? Take a big breath. There you go.
We noticed that weren't sure if he was breathing or not. We made entry into the vehicle using the captain's tool, pulled him out, and resuscitated him. Used a big valve mask, gave him supplemental oxygen, and then we used a Narcan on him. A lot of times the car is unlocked, but if we need to break a window, if we're not sure if the person's breathing, we'll do anything necessary to gain entry. He's breathing now, he's talking now. Medic Unit 9 arrived, and they're going to transport him to SLU Hospital.
Yeah, one of the more amazing things about naloxone is that in just under a few minutes that person's life was saved. So if you think someone is using whatever prescription opioid in your household, and maybe you feel like they're not the most careful, or even if they are the most careful, you might want to just have naloxone in your house just in case. I think the brain can survive without oxygen for about, how long is it, Juan? Like 8 minutes or something? But that's about the average response time of
anything usually after 6-7 minutes of no oxygen to the brain, you'll have some brain damage, unfortunately.
Yeah, and that's about the average response time of an ambulance. So if someone does have an opioid overdose, and you do have, it's always better to have naloxone on hand than wait for the paramedics to arrive with their naloxone.
And if you do take the naloxone training, we do provide the naloxone training. They follow the required steps. They did the chest rub, which kind of hurts, and if you're awake, you're gonna wake up with that chest rub. And when you wake up from an opiate overdose with the Narcan, you wake up almost disoriented because you're not high anymore. You're back to normalcy, and then he's taken to the hospital for further evaluation just to make sure there's no other overdoses that can occur, because the naloxone is only for temporary cancellation of what was currently causing the respiratory depression.
Right.
So just moving on just a little bit more on opiates, and sometimes the questions that we get, hey, are opiates the best treatment for chronic pain? There are other alternatives, especially non-drug therapies, for example, physical therapy, cycle support, massages, and acupuncture is one of the newest ones that's being generally accepted. And we've seen a lot of, for example, insurances that are covering those type of treatments now in regards to pain management. There are also non-opiate medications, of course, like Tylenol, ibuprofen, over-the-counter medications that also do the same thing that an opiate does in a lesser value. And, they do have, to some effect, the same methods of pain management as using fentanyl. All right, so moving on, just a quick reference on our sources, mostly CDC. And we're going to have Morgan Wallace just talk about our outpatient services and services that we provide.
Hi, everyone. So Juan touched a little bit at the beginning on some of the services that we offer at Phoenix House in Lakeview Terrace. So we have outpatient services for substance abuse for clients age 12 all the way to 24. That program accepts private insurance as well as Medi-Cal. So if you're unsure if we would accept your insurance, feel free to contact us. And Lolita, her email and contact information is there, and she can assist you with that. We also have a mental health outpatient program. That one has a little bit of a wider age range. So really anywhere from like very young child, so age 2, 3, we've gotten referrals for and have been able to see clients that young, all the way also up to age 24. That program does not accept private insurance, but we do accept Medi-Cal and also clients without insurance. We also have wraparound, which typically you need to be involved in either DCFS in some capacity or through probation. You would be referred either by your social worker or probation officer, but that's just a more comprehensive service where you have multiple team members, a therapist, a parent partner, and other people that are helping that family all together. And then we have MAT services. And did you want to expand a little bit more on our MAT services one?
Yes, and our MAT services are designed with the issues of withdrawals when it comes to opiates in general. MAT services is a successful treatment in combating the opiate addiction because the withdrawal effects of opiates are really harsh. We have other presentations that you guys can actually scan on our Facebook or Instagram, and there's more presentations that talk about the withdrawal effects and why MAT is so important. So we're coming at the end of our presentation. This is our contact information. You guys want to outreach, send us an email, feedback, anything, or a question, even if it's just a question, hey, you know, what does this drug do? More than likely, we've heard of it since we're out in the field with prevention, or if we don't know the answer to the question, we will definitely research it. Me, Julian, Claudia, and Stephen Flamenco always take just learning as a priority. We always try to find out what's going on in the community. We try to stay ahead of the curve for the most part, you know, before we start hearing it from kids that we work with. We like to know what's going on. So without, that ends our presentation. So I'm gonna stop the recording.